All right, so today I want to talk about something that I feel like is kind of been on my heart and on my mind, especially like with the shift in technology in itself. I think like as physical therapists, it's important that we continue to keep up with that. And so really what I want to focus on today is virtual pelvic health PT services and then like the benefits of them. And as we know, like in the recent years, the healthcare services that we have provided, the delivery of them has changed. And essentially when the pandemic of 2020 was occurring, we had to adapt the care that we were providing. Telehealth kind of skyrocketed because we could provide services without being physically in contact with individuals. I've heard personally, like from past colleagues or just like within talk in general, when it comes to physical therapy, how is it even possible that we can provide virtual services? This is maybe even more relevant to specialties like pelvic health, physical therapy. And this kind of comes down to the thought process of, well, as a therapist, we're just very hands-on. So how are we supposed to provide something that's virtual and still get the same benefits and outcomes that we do within the clinic? So really throughout this video, I just want to walk through some of the key benefits that providing pelvic health services in the virtual setting has to offer. And I think like that's just really my goal today, is just to walk through these benefits. And anybody out there considering virtual pelvic health services or that's kind of on the fence about it, I kind of want to like clear that up as far as like that there are benefits. And then there'll be a couple more videos within this series where we kind of talk about some of the myths of virtual pelvic health PT as well as treatment options that are appropriate for the virtual setting as a pelvic health PT. So first things first, not only has the healthcare world shifted tremendously over the past several years, we know that technology continues to get better and better over time. And for healthcare practices and specifically pelvic health physical therapy providers, these advancements in technology have made it possible to deliver quality care to patients in the remote setting, which is awesome. And I would encourage any physical therapy practice, especially pelvic floor physical therapy practices, to jump on this digital train. Technology, even though it comes with a learning curve at times, it allows us to meet our patients where they're at. And it allows us to further the reach of our services and serve better those that we are so passionate about helping. So let's dive right into the benefits of virtual pelvic health. So first and foremost, many of these benefits may seem obvious from a virtual sense, but maybe haven't crossed your mind as a physical therapy provider. First thing, one of the most significant advantages of virtual pelvic health services is the simplicity of improved accessibility. Virtual options eliminate the need for in-person visits, making them more readily available to individuals regardless of their location. And take it from me personally. I live in rural Emporia, Kansas. We have exactly one pelvic health physical therapist that is like within a reasonable driving distance. Typically because she is one person and in high demand, she's booked out for months at a time. And so in the Emporia area, if patients need, say, like, I don't know if I would call it more emergent pelvic health services, we really don't provide emergent pelvic health services. But if somebody is like, no, I really want to take care of this problem now, and this one individual within our community provides pelvic health services is booked for months, they're going to have to commute at least 45 minutes to an hour to access the care they need. This is one of the things that comes with living in a rural setting, but also we can minimize this lack of people getting the care that they need by providing virtual options. You know, patients no longer have to worry about if they're within driving range of a pelvic health PT they want to see, you know, kind of axing the issue of geographical location, which is pretty neat. Moving on to just convenience of care. I don't want to discount the fact that it takes commitment on both the patient and the provider when it comes to pelvic health services, regardless of if they are in person or virtual. With that being said, the virtual option allows a patient to schedule an appointment when they have time, when it's convenient for them, without having to factor in commute time or where they are when they choose to participate in their pelvic health virtual appointment. You know, they can be at home, they can be at their office on their lunch break, they can be at a gym because that's the setting, you know, that they're struggling with pelvic health dysfunction when they're participating in a gym setting. You know, and on that same token, virtual services allow pelvic health providers more flexibility in itself, both in appointment times and just accommodating more individuals without the constraints of clinical settings. You know, whether that be space, whether that be or electricity goes out, whether there be a water break that happens. You know, this kind of eliminates the same issues that happen with life. However, they kind of come about for the provider as well. So that convenience not only benefits the patient, but also the physical therapist. And we know as pelvic health providers that the issues that we talk about, we treat with our patients, they're sensitive. It's not something that most people enjoy just sharing about to anyone in any environment. And during my time working in the busy outpatient setting, or the outpatient mill, so to speak, I couldn't imagine how patients would feel comfortable talking about these sensitive subjects in such a bustling environment where potentially like quote unquote Joe or quote unquote Connie could hear the things that they're talking about because they're 5 feet away from them. And this just happens, like when you're in these busy outpatient clinics, space is limited, availability of equipment's limited. It can happen where like a patient that potentially is within hearing distance could catch on to what's going on with that other patient who is speaking with their physical therapist. And, I think this is something that in general, like why would somebody want to talk about pelvic floor dysfunction when they know that so-and-so may be able to hear me? That's not my physical therapist. So with that being said, virtual services are able to provide a level of privacy and comfort that may not be as easily achievable within the clinic setting. Providing virtual services gives the patient the opportunity to discuss their concerns in the comfort of their own home or just a private space that they feel relaxed and comfortable in. And this can help to greatly reduce the feeling of embarrassment and guarded tendencies that sometimes these patients will have for sharing these sensitive subjects by putting patients in the settings that they are most comfortable in, relaxed, and can feel like they can really open up without the judgment of somebody that's not their provider. And then I think this also maybe goes without saying, but I think it's really important to touch on. Virtual services can help save both the provider and the patient money. For the patient, for example, they aren't having to pay gas prices to have to commute to and from a clinic. And like I said before, like my living situation, if somebody was to be commuting 45 minutes to an hour, 2 to 3 times a week to an in-person clinic, that adds up a lot when it comes to gas prices. And in the same token, they're probably not going to have to take off as much work time to attend their sessions virtually because they eliminate that commute. They can easily do it on their lunch break because they have the option to be in whatever space is most convenient for them during their virtual session. So that's probably another really appealing factor to patients looking to address their concerns of pelvic floor dysfunction, but they're not having to take paid time off. As an individual, we value that paid time off. Not that we don't value prioritizing our health and using our paid time off for that, but if we can use less of it, that would be amazing. And then on the flip side of things, the provider, they can eliminate a lot of the overhead costs of a clinical facility by providing virtual services. And if you're not having to pay rent, if you're not having to pay utilities that typically come with a brick and mortar facility, that's huge. Not only are you able to not have to worry about the stresses of paying those bills, but your income to expense ratio is completely different when providing virtual services because you are not having these overhead costs, allowing your profits to potentially be higher. And then lastly, for, the provider themselves, it also gives the provider the convenience of providing virtual treatments in the comfort of their own home. Once again, eliminating those costs of a physical clinic, and also convenience for the provider. If they are able to be in their own home, they're not having to spend gas money to commute to their physical location. Really what I was hoping to achieve with this video is just highlight the benefits of virtual pelvic health services and the shift that we're seeing in medical care in general. At the end of the day, we know as physical therapists, we bring so much more value than just hands-on techniques to our clinical practice. Virtual pelvic health services, they offer many benefits that can be achieved both on their own as a virtual option or a complement to in-person treatment. So as I said before, I would encourage each pelvic health provider to consider adding virtual services to their care options because I do feel like it will both benefit you and the patient in many ways. And if this is something that you're not super comfortable with jumping right into, that's perfectly understandable. Something simple to implement would be offering free 30-minute consultation calls, basically to screen people to make sure they're appropriate for coming to your clinic to see you, or maybe alternating virtual versus in-person treatment. Basically, if you're a super heavy manual hands-on therapist and you feel like that's something that you really want to incorporate with your patients, I think that's great. But maybe you alternate, maybe 1 appointment a week is virtual, and during this session you focus more on exercise, behavior modifications, and self-care techniques that you can communicate without touching the patient. And then maybe 1 visit a week you have the patient come into the clinic where you actually provide those hands-on techniques and manual interventions. Our goal is to help the people that we serve. And if providing virtual services gives us an opportunity to do that, why not consider it? I think it's something that's at least important to consider for each pelvic health practice, whether or not it's something that you just love right off the bat. As we dive more into this series, I'll be able to further educate you and inform you on just some of the different things as far as like busting down myths of virtual services, as well as like what treatment options or what treatments can we provide as pelvic health providers in the virtual setting. If you found this video helpful, go ahead and hit the like and subscribe button. I would love that, and stay tuned for more content. Can't wait to talk soon.